Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Today on the show, we have Ashten Duncan. He is a medical student and he wrote the KevinMD article, Social Connectedness, Volunteerism, and a Remedy for COVID Fatigue. Ashten, welcome to the show.
Thank you for having me. I'm glad to be here.
We'll get into your article in a little bit, but first off, can you just share your story and journey to where you are today?
I grew up in Oklahoma, and that's actually where I've been for medical school and really all of my education so far. When I was young, I was an Air Force brat, moved around the world quite a bit. We actually lived in Japan for a few years when I was really young. And really leading up to today, I think I think back on some of the support I've gotten over the years, and a lot of the people who've really been dear mentors to me. Because piecing everything together, I see a lot of relationships that really led to me being able to be successful and get to the point I am. Plans down the line, I'm actually going to be heading off to Santa Fe, New Mexico for family medicine residency. And I am definitely very excited about that. But in the meantime, I think it's also important to continue to engage in the things I've been doing throughout medical school, which, writing articles like this one is just one of the few things I think that have been really important to me.
So we've been talking before this interview started about you matching into family medicine, so congratulations. And what were some of the reasons that made you choose family medicine as a specialty?
Yeah, so it's going to be one of the tried and true answers of I couldn't really commit to a specific system of the body, and there were too many things I think that caught my attention and really interested me as I went through. From the very beginning of medical school, I really thought it was going to be family medicine for me for a lot of the reasons that I just mentioned. But also on top of that, I'm in the National Health Service Corps, and I already had made the commitment early on to primary care. And I think from there, as I kind of went through some moments of introspection and really thinking about what do I want out of a career in medicine, I think back to the times I had even on our psychiatry and pediatrics clerkships, where I found myself thinking, wow, like I really enjoy this type of care. I really enjoy the types of services I might be able to provide in these areas. But what was funny, it was around the time I was actually on labor and delivery with our OB-GYN clerkship, where I realized, I think it's all the stuff pointing back in that direction of family medicine anyway. So a lot of it was really just identifying with a lot of the patients and the services that are provided across different disciplines. And there I get back to family medicine.
Now, one of the themes on my blog and podcast over the years is the dwindling physician interest in primary care. Now, for the most recent match in your medical school, for instance, approximately what proportion of your colleagues chose primary care as a specialty?
So we have a smaller group where I go to school. So it's the OUTU School of Community Medicine. We're a branch campus from the University of Oklahoma College of Medicine that's based out of Oklahoma City. And typically for us, it varies from year to year. A lot of the times it does kind of stick around that kind of half and half mark. Now, with that being said, that's also those who are matching into primary care specialties like family medicine, internal medicine, pediatrics. But we recognize that quite a few of my colleagues will likely go on to subspecialize, especially in the areas of pediatrics and especially internal medicine. So that's at least what it looks like from at least the initial match of those who are matching into categorical specialties that are in primary care.
Did you have a lot of primary care mentors as you were going through your medical school journey?
I did, and that's been something that's been really special to me. A lot of people I now consider either good friends, good mentors, or people I definitely want to stay connected with have been there to really mentor me through the process. Without going into any specific names, since I didn't talk to them ahead of time about this interview, I will say though I've had really strong mentors across departments too. One of my earliest faculty mentors is in the Department of Pediatrics. One of probably the greatest people I've worked with is in the Department of Internal Medicine, and all of them have been nothing short of supportive and also really, I think, illustrative of the kinds of work you can do in primary care. I think that's definitely something that a lot of students don't get enough exposure to, and as we kind of run into this issue of kind of not as many people going into primary care, therefore not as many mentors to show students the ropes. I think we do struggle in a lot of parts of the country to really give students that robust experience and to show them that you can really be a leader, you can really be a change agent in primary care, and and still deliver some some specific care depending on the needs of your community.
Well, I think I completely agree with what you said. I think that one of the things that I hear from medical students is that there aren't a lot of primary care mentors for them to model after during their education years. And the fact that you're giving a more positive slant on that, to me, is very encouraging.
Definitely. And I for everybody listening in who has any interest in really, getting involved, I really encourage you to look into what leaders in the greater medical community are doing. There, while we are very grateful for people like Dr. Fauci and others who have really kind of, I think, risen to a level of visibility to the public that are definitely noteworthy and really deserving of the highest praise. I do want to encourage you all to really reach out and look at what your local medical societies are doing. For example, coming from family medicine, I speak specifically to like the American Academy of Family Physicians, and on the state level, our Oklahoma Academy of Family Physicians, because you just be surprised what you might find and the kinds of mentorship that may not be available to you right at your medical school, but may be available to you, and just, with just a phone call or an email.
So let's transition now into the KevinMD article that you wrote. It's titled Social Connectedness, Volunteerism, and the Remedy for COVID Fatigue. Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
Definitely. So, going into this article, what I really wanted to present was actually a case for some of the work I was doing at the time as the Director of Community Engagement and Health Equity for the National Student Response Network. So in the opening of the article, I kind of go through what has become more of a norm for physicians and other providers today, which is a telemedicine visit with a lady named Mariana who lost her husband not too long before the encounter, and who had really been struggling with a lot of the social and the physical isolation that the pandemic has brought on. And we recognize, recognizing that our elderly population in the United States and really across the world, the people in those populations have definitely been subjected to more hardships from not being able to see family and not being able to, really engage in the later years of their lives. And I think many of them have been truly deeply worried on a level that, for the two of us, we may not necessarily worry about as much, because we recognize that we'll do what we need to do. And if it's just a year, that's fine. But I say that because as we kind of look across our community, different people, for some people, a year is very significant. And so kind of transitioning into the other parts of the article, I really wanted to present a case for why that social connectedness piece is really, I think, going to get us through a lot of the ups and downs of the pandemic. We're now seeing a little bit, a lot bigger light at the end of the tunnel when it comes to the vaccination rates increasing, and I think slowly but surely creeping toward herd immunity here in the United States. And there is a good chance that maybe if we were to have this conversation over later this year, that we may be talking a lot differently about these things. But for right now, a lot of parts of the country are still experiencing these things. And I think it's important for those of us either in the medical community or those who are advocates for people who are being served by the medical community to really be connected with those in our community. For me, the National Student Response Network was actually just one of a few things I was trying at the time to stay connected myself, because even though I was still able to fortunately here in Oklahoma get back out to clinical care responsibilities and everything else not too long after the pandemic really took hold in the United States, I definitely recognized that there was a need to really kind of engage long term and that level of self-care, and also that kind of reciprocal benefit that you get from connecting with others. So really, just to make a long story short with this, the biggest things about it is the National Student Response Network is just one powerful resource for medical students and other health profession students to get involved with their communities if they find themselves still struggling to find those kinds of volunteer opportunities, service projects, whatever the case may be locally. there are other opportunities as well. And what I really wanted to deliver out of all of this is that, I think in order to get through this, we need to recognize that we are social creatures. And I think some of us have made a lot of concessions to get through this, but there are ways that, just like we're doing right now, that you can use the power of these virtual platforms and other similar methods in order to stay connected with people and serve people like Marianne.
Now, tell me some of the specific initiatives that your organization did to help maintain the social connectedness, especially in the elderly population.
Definitely. I've been so excited to see some of the recent developments. So I'll start with the biggest recent highlight that I saw from them, because I recently transitioned out of my role as one of the directors, and just in preparation for residency coming up. But recently they actually have gained a lot of traction talking with the Biden-Harris COVID-19 task force and some of the different experts who are on the task force, in order to really push forward the role of health profession students and administering vaccines to the community.
Mm-hmm.
Now that we're kind of getting to the point, especially under this current administration, of opening everything up, very, if not now, very soon for all adults in our community. There's definitely going to be a need for a higher throughput for I think especially in higher or more densely populated areas, and seeing that is just one example for our elderly population of making sure that people aren't that access to vaccines remains as open as possible, and specifically making sure that we can actually get more people out there, needle to arm, that kind of thing, to make sure that we're getting closer to herd immunity. Because for our elderly population, we recognize that's one step closer to getting them back connected with the people who are most important to them, and then for themselves to also protect them from COVID-19 and just the dangerous infections that we've run into here in this country. Besides that, some of the other efforts have been, especially when I was still around, were around really getting involved with certain populations where service to elders is really important. So with some of our Native American tribes in the United States, that has been another focus of the organization, in order to really, again, push toward, trying to stay connected, trying to get students involved, building capacity within our health profession students, who will later become part of our workforce. And I guess above all else, helping people develop an appreciation for one another, and helping health profession students see themselves as change agents in more, or that in a way that extends beyond just direct patient care.
Now, give us a sense of the relief that some of these elderly patients had when you helped them with social connectedness through the various initiatives that you did.
So, I think, I think back to some stories I heard from some of our volunteers, and, there was one story that stands out to me about an elderly gentleman, kind of like Mariana in the article, where, his wife had passed away. It was a couple of years before the pandemic. So, I mean, he had just been kind of getting used to just what was becoming the new normal for him, because his children live on the other side of the country, not, even in pre-COVID times. I mean, it was still difficult to stay connected. And for them, it was checking in to see, just kind of almost like, I think it was a kind of more in the context of kind of like auxiliary help for like intake and stuff for a community health center that was trying to reach out and make sure they were getting their elderly patients set up with these types of telemedicine visits like what Mariana had. And I just remembered hearing about how how grateful he was just to talk to somebody else, and somebody that showed care. I think in a lot of ways, even if you feel like you can't provide a service that might seem like it would have some substantive benefit to a patient like this gentleman, just reaching out and being connected, that human touch, really, even over something like Zoom, like, I mean, it's so powerful. And for people like that gentleman, I mean, it meant the world to him. And he had this, I heard he had this huge smile on his face the whole time, and just was very animated. And I can imagine that must have been a huge transit or a huge change from where he was probably at before that. So again, small things like that, just making a call, connecting over Zoom like this. I mean, these things really matter to to our elderly and also to others who feel isolated during this time.
We're talking to Ashten Duncan. He is a medical student and he wrote the KevinMD article, Social Connectedness, Volunteerism, and the Remedy for COVID Fatigue. Ashton, as the pandemic is slowly getting better, as we get more vaccines into the arms of more and more people, can you just reflect on how this last year, especially your emphasis on trying to address social connectedness, how has that impacted you as an upcoming physician?
Definitely, and I appreciate this question because I think in a lot of ways we can all relate to this because I think just as a world we've gone through a lot of changes personally that have been a reflection of the environment we've really kind of had to work within, and for me, what this has meant is becoming a little bit more in touch with some of the creativity that's always been kind of the joie de vivre for me, and the things that really have kept me going, both during medical school and before. And during this time, I've actually found it very powerful to connect with the works of other people. I actually have my phone sitting next to me, which reminds me of the Audible app I have on there, and all the the great books I've been able to listen to during this time, because that's a part that I've really been able to engage in a meaningful way, which is translated into some of the writing too. And as I look toward the future and kind of thinking about what kind of physician I want to be, and the things I even want to get out of my training and residency, I really consider that creativity to be so critical. And I want to just tell everybody listening in to this podcast interview that it's something that is so easy to lose. And I see it with my colleagues sometimes. I see it with others across the board that we and a lot of the health professions, we find ourselves giving a lot of ourselves and becoming emotionally, spiritually, physically exhausted. And you have to have a way to recharge that battery, and you have to have a way to stay in touch with yourself, because I think it's easy to lose kind of touch with who you are in favor of just getting the work done day to day. And for me, that's become a cornerstone. And I've actually started to kind of incorporate more and more pieces of that into some of my research and stuff I do on a regular basis, in order to understand more about some of the therapeutic value of what we're talking about today, that social connectedness, building up people's capacity for change. In primary care, to kind of draw that, kind of to call back to that, I think we struggle with that, and we're going to, I think, struggle with it majorly in people who are so taxed from the pandemic. And I think going forward, that's going to be a central piece of the work I do, is helping people stay in touch with themselves, helping people stay in touch with others, and making it clear to people that they do have the capacity for change. And if their health goals are at the top of their list, I'm here to make it happen.
And my final question, what's your take-home message that you want to leave with the KevinMD audience?
Definitely. So, I think the biggest thing is, be bold, be brave with yourself. And, for me, I know it sounds cheesy, and I know those are, often just used as platitudes, but to back it up, I think oftentimes in medicine and I think other areas of life where people are working with others who are just, really engaged, very, very intelligent, very, very motivated to produce changes in the world, it's hard to find a place for yourself. And for me, this has involved really just taking one step at a time. Write that one article, get your message out there. One thing I will say is that there's a role for the words of medical students and physicians, other health professionals, and I really make sure you get your voice out there. It can take a while sometimes finding it, but again, be bold, be brave, and stay in touch with yourself and stay in touch with others.
Ashten, thank you so much for sharing your time and insight, and thanks again for being on the show.
Thank you so much for having me.